to official business now at 8:20. Heading into the KUAM News Zoom room where we're talking about bars, right? We have Mary Rhodes from GHRA, Renee Logi from the Guam Women's Chamber, and Phil Roberto. It looks like he is actually in the venue. Are you at the venue right now, Phil?
I am in a very empty venue.
Right, and it's been, you can hear that echo.
I almost forgot what it looks like. Goodness.
I think I've sat in that chair before, Phil.
We're hoping to bring life back to it in the coming days.
Right, and so
Mary's help, of course.
Yeah, and then we'll just start with that, Mary. So you were basically deputized to lead the effort to reopen the bars. We heard it here first. I don't know if you heard it first on the link on Friday, but just tell us a little bit about that and the work that you've been doing since then.
Yeah, actually, I was contacted by the Director of Public Health, Art San Agustin, on Thursday, and I know that they were very interested, finally, in considering bars for reopening. Public Health and, of course, the Governor's Office, you know, we've been working with them on the Economic Advisory Committee and the working group, and we've been asking for bars for a while, as well as for indoor dining at 50% since about December. And so we were really hoping that it would come a little earlier, but regardless, I think it's a good sign that they're now willing to consider the reopening of bars because there are even a lot of restaurants, as earlier said with public health, you know, some restaurants and bars that are also restaurants, even they haven't opened even at 50% because occupancy levels, you know, you have to have a certain amount just to even cover your costs with operations, especially with rehiring personnel, getting your establishment ready to reopen. So we've been asking for some time now. And so public health was aware of that with the front office. And I think it's really key that we also state that, you know, GHRA has been working with GBB and public health on even reopening guidelines. There are reopening guidelines that exist on the website of public health's website that they worked with the Guam Chamber of Commerce and the Guam Women's Chamber. I have to say, though, those guidelines are fairly simple in the fact that it really identifies some of the basics. And so businesses have submitted their plans for reopening, including bars. And so they actually have several bars listed on there who have submitted plans. But as far as an overall plan guideline, there wasn't one created for bars. And so that's why they reached out to GHRA. Also, I think the reason why they're reaching out to GHRA is because we've been pretty vocal that those guidelines have to be kind of fleshed out further. We can't deal with what we were dealing with just in May. There are a lot of new things coming up, such as like ventilation, making sure, like you talked about earlier about a restaurant that you went to and you were able to touch the food and the plates. And that was always in the guidelines for CDC, actually, about shared objects. So my point is that even the health and safety protocols, the guidelines that are on the public health website, we probably have to replace those with updated guidelines for businesses because they no longer are enough. And so what we've been doing at GHRA is working on health and safety protocols to publish these with GBB for the reopening of tourism. And we've had one for bars. And I'll send you the link to the guideline that I referred to, which is from the CDC, and it's actually specifically for restaurants as well as bars. And some people, you know, are wondering why restaurants or bars are starting to try to apply for cafes or restaurants. And they're trying to survive, basically, right? They're trying to find different ways. But there are a lot of challenges in going in and operating as a restaurant. And I know that between Malu and Janella, they provided some information, but they were pretty quiet on some other stuff because, you know, they're really there for more an enforcement piece. There are a lot of things business owners have to reconsider if they are going to convert to a restaurant. It's not just having kitchen equipment. You have to know the Guam Food Code. You have to go through licensing training to have a food service manager on duty at all times. You have to have a lot of things in place, whereas a bar you don't have to do all those things. You have to have your basics with the hand washing station, sanitization, all that. So we met with several bar owners. Phil hosted a meeting actually with some of the bar owners, and the other night, and we shared the CDC guidelines together with what the public health currently has with restaurants. And so we went over those, and I'm planning to submit that to public health today so that we could review it by tomorrow. I know that the economic advisory group will be meeting as a group tomorrow, and the person in charge of that is Ken Cook, and they did reach out to me last night just to make sure that we're ready to submit a draft plan at least. And so I know that they're planning to meet with the governor on it next week. So I did get confirmation on that. So this is something that is strongly being considered, and we actually have somewhat of a timeline where we can expect this. What I don't want to see happening is, we should give the business owners some time to prepare. I know that when announcements have been made, it's like effective the very next day or in a couple of days. And we have time to get businesses to prepare. Even moving restaurants from 25 to 50% occupancy or planning to open after being shut down for 6 to 11 months. There's a lot of things you have to do with your facility to get it prepared with the air conditioning, the chillers, getting your inventory out and getting new inventory in. But they're not ready to do that until they know, at least get reassured that they are planning to reopen.
Mary, how difficult is it? I'm just going back to the bar restaurant thing, because we've seen just during the course of this pandemic, some places that I thought were just bars able to open, but then when you look at their social media, they're putting the food out like, hey, we're doing food, come get a pork chop. So I guess how challenging is it for a bar to do everything it has to do, because it sounds pretty challenging, and transform into a restaurant which is allowed to be open?
It's very challenging because you can't just place food out. Like I said, you have to know the Guam Food Code. It's actually against the guidelines and the executive order to even have shared food or have people bring in food. So they're already violating all of that. And so what Phil and the other bar owners would like to see is just reopen bars, allow them to operate and remain as bars without having to convert into other things. It's really important that, we have different kinds of businesses operating, and bars are really important. And so that's why we've been pushing that, as well as getting all of our restaurants open. So part of that is remaining safe and getting the guidelines out there and helping businesses. So one of the things that came up too is, some of the bars may not know their occupancy levels. And so I contacted the fire department the other day, and we're going to be visiting some of the bars because they may know their occupancy from a standing only, but maybe they don't know it from a sit down, what is 25%, what's 50%, what's 75%. For their occupancy load. And so you really have to go through this with Guam Fire Department, but also eventually with DPW, because your occupancy permit comes from DPW, but the fire department is the one that generally identifies that. So I'm doing a couple of walkthroughs today with the Guam Fire Department. GHRA has had a very good longstanding relationship with the fire department whenever we've needed assistance to help businesses either open as a new entity or reopen because of various issues, whether it's a fire code issue, building code, or because of COVID.
I guess how are you guys planning to do the protocols address? Because, it is what it is, but the bars last on the list. But when we ask about them reopening the bars, the thing that we hear is like, oh, when people drink alcohol, they get loose, and while whatever protocol may say, you show up, like let's say for example me and Jason go to the venue for happy hour, we sit down next to each other, we take off our masks, we're having our drinks, but then we see Sabrina and Joseph over there, and it's like they're not, oh hey, and then we go over. So that's what they said is the big risk of spreading the COVID. So how do the protocols that you guys are coming out with address that, and what would be the procedure if, like, for example, Jay and I go to the venue for happy hour? How's it going to be? Is it still going to be fun? Because it doesn't sound like it's going to be fun.
Well, have you tried eating out at a restaurant or going for a social gathering at 25 people right now? It's the same process. A bar is only a different kind of facility that you would go to for entertainment, right? So the same thing with restaurants, the same thing with bingo halls. You're going to see friends. As long as you maintain distance, wear your mask, sanitize regularly, don't share from the same containers. It's the basics. And so there's a responsibility that the bar owners and the staff have, but there's also the responsibility that the guest has to have to maintain social distancing measures and all of the protocols. So it needs really everybody's cooperation. And I think that's what GHRA, Guam Chamber, and Women's Chamber have always put out is, we can only do so much in writing the guidelines and working with the businesses to get them to reopen and to maintain opening. But we have to have the cooperation of our customers and guests when we're trying to enforce something, especially if you are drinking alcohol, whether it's a restaurant, a hotel, a bar, or any other place that you might have alcohol at, that you're really there with good intentions, that you're not there to really cause a ruckus, and you're going to follow all the protocols and listen to the staff, because you really don't want to just hurt any chances that any of us have, not necessarily one entity or one type of industry or establishment, but really for the entire community.
I'd like to hear from Phil. You've been shut down. Other bars have been shut down for months, almost going on almost a year. And we do, like Chris said, here's the big bad bars. But you do kind of see like the game rooms are open, the bingo halls are open, restaurants / bars are open. Have you ever felt at any time that bars are being targeted, or they have this are getting this bad rap?
It's just been quite frustrating playing the waiting game because, this is our second shutdown, and it's been twice as long than the first. And then every time we hear that rumor, bars are going to open next week, there's going to be a change, there's going to be an executive order, and it doesn't happen. You get your hopes up one week, and it's a huge letdown. It's kind of demoralizing. And I feel the frustration of my fellow bar owners who've, been very patient. I think we've been extremely patient. We understand the importance of all the protocols that need to be adhered to make things happen, to create a safe environment. And I think we demonstrated that very well during the first opening back in June. There's been no actual evidence that a bar on island has been a cause of an outbreak of COVID, or been super spreader. There's just this notion through the CDC that bars are high risk, but our names as bar owners are on the line in terms of making sure that we do provide a safe environment, not only for our customers but for our staff. And we took all the efforts, the guidelines that we were given, buying sanitization equipment, putting hand sanitizer locations throughout the bar, separating tables. We did stuff in the beginning that weren't even required. We had a sign-in sheet during that 7-week period, and we asked our customers just, out of abundance of caution, to sign in. Some were resistant because it wasn't a requirement by public health, but they needed to do what they needed to do to come in, And so the waiting game has been it's been tough. And as Mary said, we're not going to open this up overnight. I mean, in my case, I've unplugged a lot of our equipment. It's been sitting idle for about 4 months. Hopefully, if I plug it in tomorrow, it'll start back up without any problems. We work with multiple distributors, and we need to get on their schedules to get deliveries if an opening were going to happen, let's say Monday. Today wouldn't be a great day to announce, I'm allowing bars to open Monday, and now you got to do the mad scramble to, contact all your distributors and say, I need this, I need that. So yeah, timing is important, and we just hope that the work that Mary and the Women's Chamber have been doing on behalf of bars will be sufficient to get us back up and running next week or the week after.
Is that kind of, Mary, what you guys are hearing? You're crossing your fingers next week We
Yeah,
could-
I mean, I think next week is when the governor will be reviewing the protocols. And so it won't be a opening by next week. I think that we're going to be presenting the information to the governor through the Economic Advisory Group, but also where public health will be addressing those things. And so I think it's important to understand there is a process. And obviously, you know, every time that we've talked about changing protocols through PCORs, sometimes it takes longer than it needs to be because it has other external factors that, you know, of course, the governor is looking at. But this is the first time in 10 months, or first time since the second lockdown, that we've been asked to really, you know, start the conversation going regarding bars. And so I think that's positive. And I'm sure that it was a lot of pressure because bingo halls and other things are open. And so there's questions, even movie theaters are going to be opening. So I think just the fact that you're having these kinds of other facilities or establishments open where there are larger gatherings, you kind of have to wonder why aren't bars being considered, especially if they're going to be subject to the same protocols as restaurants that could be easily maintained, honestly. You know, why can't they be open already? And so I think we have to give everybody a fair shot at this, especially when we've done so much to try to get us to reopen with all the other kinds of businesses. And I think the timing is right, especially now with the vaccinations in place, rapid testing in place. And there's a lot of work that's gone into this. And you know, like Phil said, you know, there's been issues with bars and, you know, a lot of people are frustrated. They've had a lot of bad inventory sitting that's now expired. They're going to have to replace that at losses. But I can tell you, you know, Renee is also GHRA's chairman for the Food and Beverage Committee before she went to Women's Chamber. But something GHRA, Women's Chamber and Guam Chamber met with the Chief of Staff and Gita on was also the rent relief program and some other stuff through the small business grants that Gita did. And so a lot of that was really in consideration because of the closures on these types of businesses, not just bars, but other small businesses. So I know it's not going to replace everything, but it's something that I think we've been able to at least get the governor's office to consider strongly in compensating for their losses. But we have to find a way moving forward. And this is the first time that they've actually been willing to discuss reopening bars.
So based on the protocols that, you know, that you guys have put together and the discussions with the bar owners that Phil had, can you tell us what exactly are the protocols? What are the changes we're going to see if the governor approves them?
Sure. Renee, do you want to go over some? And then
Yeah.
I can...
It's gonna mimic very closely what is being done by restaurants right now, because for now they're gonna have to follow similar protocols and guidelines with the table seating, no seating at the bar, and stuff like that. So, you know, the main requirements will obviously be contact tracing will be helpful, temperature check, sanitation at the entrance, making sure that the tables are socially distanced, and just sanitizing items, high contact surfaces, tables in between use. You can actually refer to the restaurant guidelines that were put in place by the Business Recovery Advisory Task Force, and we're kind of working off that and the CDC guidelines that Mary mentioned, just to make sure that we cover all aspects as it relates to bar, because obviously there will be some parts that will be slightly different based on how bars operate, but we are making sure that it will be safe for both the employees as well as the visitors of the establishments.
Renee, is it just like a kind of a cookie cutter protocol, you know, as we have like places like Mosa's or Crust or these restaurants that have a bar in them? Or are we just using the protocols that they're using already and kind of, okay.
Yeah,
Well,
this is basically
the same, right, for the service industry. Yeah.
Right, yeah.
But there are some things that Renee mentioned. So there's a difference between shall and should when you read the protocols. So shall is basically the minimum requirement. And then should are other recommendations that public health would like to see, but it's not necessarily a requirement. And so, like I said, there are several bars that we met with that actually submitted their plans to public health. So they just need to be fleshed out further to make sure that they keep all of the guidelines in place. So yes, these will be basic minimum requirements. If you want to add more, like what Phil had done in the past, for sure. So with the contact tracing, all that's required really is the sign-in sheet with your name, your phone number, if in case they need to, and the time you entered. So they need to trace you back for that, and you need to keep your logs for record keeping for some time. And then the number one things that DEH looks for is really signage. You need to make sure you have a sign of wear mask before entry. You need to make sure people are wearing their masks throughout the entire stay, unless they're eating or drinking. So when they're talking, sitting down, they should have their mask on as well. But eating and drinking is the only time when you can take your mask off. But interacting with other people, it's social distancing is still 6 feet required between the tables when you're sitting down. If you're in the same household, then obviously you can be together. Renee mentioned seating at the bar. We are going to put in the guideline that as long as your bar can maintain a 6 feet distance between you and the bartender, then you can be allowed to have bar stools, as long as they're 6 feet apart. Some bars are wider than others, so we shouldn't mandate no seating at the bar if your bar is very large. So for example, like Sea Grill has a bar right upstairs where it's very long and wide, same as Mac and Marty's. Their bar is extremely wide and long. So we were telling Art, that's something that they could consider, is just have 6 feet between the bar stools. So it's not going to always apply to every bar. Every bar has different layouts, and you just have to modify your layouts to fit the need. And of course, what public health does, if they are going to do inspections, I know that they said that they've been limited to just weekends for restaurants and possibly bars. What they do is they actually do a walkthrough with you, and then they give you a time frame when you have to make modifications. And it's usually within a 48-hour period where you have to make those changes. So they give you time to make those changes, unless it's a direct violation, like not having signage, no one is wearing a mask, not even your staff. You need to make sure you're meeting the minimum. And so those will be clearly outlined of what the basic minimum requirements are, and then what are other recommendations, similar to what's already on the public health website.
One thing Mary mentioned is not the cookie cutter approach. Like requiring seating. There's a couple bars out there that we discussed the other night that are not really designed for sit down. They have maybe 3 or 4 tables, and it's they're there for the live music, and there's a lot of standing. That's going to be a challenge for some bars, because they're going to have to go out and get that extra furniture in order to provide seating for their customers to follow the recommended mandates. To me, that's a challenge. There was a notion that maybe there might be limited bar hours. We don't know that's going to be enforced or not. But again, that was a concern as well, because not all bars have their peaks at the same time. In our case, we rely on a good happy hour crowd after work. Whereas some of the bars in Tumon, they also rely on a crowd after work for the F&B and hotel workers to get off at 10, 11 o'clock. And their surge and peaks come at that late hour. So if there was a recommendation to have limited bar hours, it wouldn't be helpful to all bars. Right. That's the thing that we're worried about, that that we are allowed to operate like restaurants, because the restaurants don't have limited hours. They put their own limits on themselves when they decide to close, and our licenses allow us to sell alcohol from 9 a.m. to 2 a.m. We've all paid for our license, our ABC licenses and our business licenses, and again, it's been 26 weeks since we were last officially open. and we want to get back to work. We don't want to be in a situation like some bars are. They're opening kind of underground, because they need to make ends meet. I can sympathize with what some of these bar owners are having to resort to not get kicked out, to kind of stay on top of their bills and stuff. So, as Mary said, it's time that we get back to work, help prepare our island for opening for tourism and whatnot. And I think we can all be responsible bar owners and party goers, if you will. I think it worked well for that 7-week period that we were allowed to open, and it can work again.
Phil, what about dancing? Mary, anything on dancing?
I think there was no dancing allowed last time.
No dancing during COVID, guys.
No cha-cha.
Well, there's nothing in there. There's no language about dancing, actually. It's just.
Wait a minute.
it's
Are
always
we in
about
the movie
maintaining
Footloose
6
right
feet.
now? Are we in the movie
Cha-cha
Footloose?
with 6 feet, right? In between?
Yeah.
Hey, Chris likes to twerk, so that's why he was
Yeah.
asking.
Yeah.
Yeah, I think dancing is the least of everybody's worries. Honestly, I think just some kind of.
Hey, I
business
asked
would
the
be
hard
great.
questions, Mary. That's what I'm here for. And people want to know about
know,
dancing.
But yeah, I going back to what Phil said though, whether it's dancing or drinking or just socializing or birthdays or whatever it is, I think that it's really important that we are consistent with what we implement, whatever we choose to implement. And like Phil said, I know that there are concerns with limiting hours. A lot of places in the States have limited hours of operation, as well as in Korea and Japan, but it has to be consistent. So we do have an ABC amendment bill coming up tomorrow at the legislature at 9 a.m. And those amendments are really important because it does affect the hours of operations, and who knows what might come up on the floor too. But we've been trying for a very long time to get these amendments through to update the ABC laws. And that's also to include to-go, right, alcohol. So there are a lot of opportunities where we can actually work on these ABC rules, but it should be applicable to all depending on the class license. And so what Phil is referring to is just the maintaining operating hours. It should be consistent with on and off-premise operations. The bars should not be targeted any different than any other type of business that has a class license for ABC licenses. So I think consistency will be key when we reopen.
Do you know anything about the percentages yet of occupancy?
Yeah, right now restaurants are at 50%. So the bar owners, they would like to see it at least at 50% to match the restaurants again.
I did want to ask.
50% of maintaining capacity, right? So also maintaining all the safety protocols. So if your 50% is 150, but in order to maintain, so it has to have both. That's what Malu will always say, is if your 50% is 150, but if you have to maintain 6 feet between tables, but your max capacity at that point is maybe 100, not 150 anymore, because 150 is standing next to each other, then your occupancy is going to be based on 50% of 100.
Phil, how many people you think you can get in there at the venue? Because it gets pretty tight.
We've been rated for 170 by the fire department. People kind of like freak out about that, but it is based upon the layout of the furniture and giving wiggle room for standing people standing. If we were to do the 50%, obviously we'd be around 80 people. We do have seating for roughly about, I want to say 65 comfortably right now in terms of the tables and stools that we do have throughout the bar. Since there are no fundraisers, we could actually extend our seating area into our back room and possibly, hit that number of 80 if we wanted to. But, we kind of like it to be manageable as well. Again, it goes to trying to be a responsible owner. It'd be nice to have 170 people and get back to what it was in the good old days, but the reality is we're not going to get there anytime soon. If we don't, follow the protocols for safety. And so we're willing to take the baby steps, get back to 50% for starters, because that would be sustainable for us.
Phil, can you kind of talk about so people kind of have understanding that bars aren't all that bad, just the kind of losses that I guess your business has taken as a result of the closure, and even maybe the money you're gonna have to fork out to reopen. Did you have to lay off people?
It's in the thousands. It's in the thousands. We estimate that this year, or 2020, we lost revenue to the amount of about $250,000, $250,000 that we didn't make because of COVID and the closures. We've had to throw out product. Everything has a shelf life, and everybody likes a good fresh beer. The beers have their born-on dates, and you want to serve the best beer to your customers. There are a lot of beer snobs out there. They look at the bottle, they look at the date, and they don't want it. And some of those things are quite expensive, especially when you start talking craft beers. Those have a limited 6-month shelf life. There's a lot of stuff that went to waste. So losses in the thousands, and to start back up on a good weekend, we probably have to put in about $7,000 worth of inventory to get through a good weekend. If it's going to be anything like the first opening, it's a slow, gradual process. It took us about 4 weeks to get to a steady level of revenue. People just getting their feet wet about going out. I think for the length of time that restaurants have been open, I think people have become accustomed to the protocols. And like we said, we're ready. Bar owners are ready to follow the same protocols that restaurants have been following. And I know we can do it. We've done it once, and we're ready to do it again. So.
Were you able to get any sort of federal assistance or avail yourself of anything from GHRA or CARES Act money to kind of help offset the $250,000
Yeah,
loss?
we got some, but it evaporates very quickly after you've been closed for a while. The first PPP was good for like the first 10 weeks. There's another PPP out. We'll apply for that. The challenges that you indicated earlier on about PUA. People have become accustomed to PUA. Are they ready to go back to work, or are they comfortable enjoying staying at home and surviving off the PUA? That's going to be one challenge. Are my people ready to work? And if they're not, then I am going to have to work quickly to find some new employees who are willing to, and they're going to have to go and get health certificates and ABC cards and whatnot. And that's a challenge because, those services offered by the government are on an appointment only basis. So you got to stand in line. So it's not going to be, I'm optimistic that it'll be an easy opening, but, there might be challenges that lie ahead. I haven't really reached out to my staff to say, hey, you ready to come back next week? Because I don't want to get their hopes up that we're going to open and that, that order never comes down that bars are allowed to open. So, I get my own hopes up that, things are going to change. And it, like I said earlier, it's frustrating when you think the car score is low, schools are opening, bingo halls are opening. Wow, all these places are opening, but why can't we open? And I don't want to, as we were saying earlier, I don't want to go change what venue is. I'm happy being a bar. I don't want to be a cafe. To go, and it's a loophole. And I think it's disingenuous to say, oh, you're a cafe, so you can open and you can serve alcohol, because I mean, you're doing the same thing a bar is doing. And I know there are a bunch of places that have gone out and converted, to that cafe status, but they're doing the same thing that they were doing before.
Right.
They're still a bar.
That's
They
why it
just
was.
got a different.
Yeah, that's why for me the
Yeah.
argument against the bars being closed, it was almost moot, because whatever they're fearing is going to happen to the bars is already happening at a restaurant that has bars. You know what I mean? So
Yeah.
agree with you there, Phil. Anything else, Bree?
No, I just wanted to ask him. Hope only takes you so far. I mean, but was there any point that you wanted to say, "I'm just gonna shut it down. I'm done with this"? I mean,
It's been a good ride. I mean, in December we would have celebrated 10 years of being open under our ownership, and that came and went, and no celebration. So, I'm hunkering down, waiting, because I know my customers are waiting as well. They've all expressed that their sentiment that when bars are allowed to open, we'll be there, and I'm appreciative that we have a good following, that we've built up a good clientele over the last 10 years, and that they're eager to come back. And they were good customers when we were open. They all followed the rules. As you were saying earlier, we had one incident where we had a known person who had COVID and was in the bar at a certain time. And fortunately, we because we have CCTV here, we went back, we looked through the tapes around the time the person was here, and kind of followed his movement and to see, did he come in contact with anybody, or did he have his mask on, or was it off? And we had contact tracing back then. We had our log sheets that we would keep for 21 days, and fortunately nothing happened. That person went on to recover, but nobody got infected from his presence here in the bar. So we know the protocols work. We just want to put them back into action. And then I got something for you folks for when you're ready to. For Chris and Sabrina.
There you go.
Now
Safety first, Phil.
that I'm going to give you, Chris. For your
Right
good,
on.
dear Shirley Temple. Insert straw here.
Right. All right, put my joint in there.
love it.
But yeah, we're ready. We're ready.
There you go.
And again, I can't thank enough Mary and Renee from the Women's Chamber for helping spearheading this on behalf of all the bar owners. I don't know how many strictly bar licenses there are out there. I'm sure it's easily 100, if not more. But I know these people want to get back to work. And there was one sad thing about the meeting the other night that I had heard, and I still don't know which bar owner it was, but there was a discussion about a bar owner who actually, committed suicide in her establishment, just because I guess out of the, I don't know, but I can imagine the frustration and desperation that you've built up a business and you're not allowed to operate it, and that's challenging. It's a stress, and so rest in peace to that woman, and I hope nobody else goes down that path. But we just want a fair shake like every other business on Guam that's been allowed to reopen.
647-8833, guys. That's the number for the crisis hotline over at Behavioral Health and Wellness. Mary, thank you. Renee, thank you. Phil,
Thanks.
thank you.
Good luck.
Thank you.
Looking forward to that mask, my friend.
Thank you very much
Thank
for the
you.
opportunity.
Okay.
Thanks for having us.
Always.
Be safe, everybody.
You too.
Be safe.
9 o'clock, we're KUAM FM, Agotni, Guam. We'll take a quick break and we're coming back.